If you've ever swaddled a baby, you know the comforting, soothing effect it can have. Well, now some physical and occupational therapists are finding that a garment originally designed to help support children with cerebral palsy is helping kids with other disorders achieve the same effect as swaddling, feeling comfortable within their own bodies. This unusual-looking undergarment was originally created for patients with cerebral palsy, with stretchy material and straps offering a support system for the muscles and skeleton.
They act like little muscle supports and little postural assists, and the child gets to live in the changes I know I can get in therapy, but that I have never been able to make stick, because you really need practice.
Physical therapist BEVERLY CUSICK invented Theratogs.
If you turn your shoulder this way and you want to raise your arm, you'll raise your arm, you'll just use all the wrong muscle. So kids with movement disorders do that. Their purpose prevails over the way they use their bodies. They'll recruit whatever they've got to get where they're going. So with Theratogs we can say, okay, go, but do it with a better body.
2.5-year-old Emily has autism. Her occupational therapist had used Theratogs in children with CP, but after trying them on herself, decided Emily might benefit as well.
It kind of was the effect of when swallowing an infant. It gives that calming, soothing sensation that I thought, well, if that works, we need to try it.
It was like the door was open like this much, so therapy could only come in through this much of area. And then when the Theratogs were on, and it was an instant thing.
Mom Linda says Emily seemed better able to concentrate and focus, something her speech therapist picked up on.
She said, Linda, she's not rocking back and forth anymore. She's not doing this on the tables anymore. She's not having to feel things. She's not doing this. And that was the first time that she had seen her with the Theratogs.
No clinical research has been conducted involving Theratogs, although there have been smaller studies looking at changes in the way children walk when wearing the garments. Cusick welcomes additional research. In the meantime, she enjoys the changes she sees in clients.
I feel really effective as a clinician now. I really feel I can definitely change kids' lives and adults' lives.
Therapist Tina Blythe of North Bay Pediatric Rehabilitation in Fairfield has seen marked changes in Emily.
I think it helps her to refocus because it calms her sensory systems down in a way that takes her out of that fight or flight mode.
Linda's convinced the garment has made a difference for her daughter. She's still experimenting with how often Emily wears it.
I've had therapists ask, she's not talked today, huh? And I said, no. So was it that bad? And they're like, yeah, it wasn't such a good day today.
Linda doesn't see Theratogs as a cure, but she does believe the garment allowed her daughter to get much more out of therapy than ever before.
Because she was feeling secure in her Theratogs, her second skin, the door opened this much, and she could just focus and grab everything and see how things worked.
For the Garrett family, the comfort Emily seems to get from Theratogs is a comfort to them as well. Now, Theratogs cost between $400 to $600. Some insurance plans do cover them. Clinics that recommend Theratogs often have samples you can try before you buy. Go to ABC7news.com to learn more about them.
Clever ideas.